Hi, my name is Jessica, and today we're going to be discussing heart failure. Did you know that heart failure is the leading cause of hospitalization for older adults in the United States? Heart failure affects millions of people, and understanding it is crucial for recognizing the signs. Approximately 6.7 million Americans over the age of 20 have heart failure. A couple months ago, my other half was diagnosed with heart failure. Due to our unexpected experience, I feel it is important for everybody to be aware of heart failure. It can happen to anybody at any time at any age. Let's start by discussing what heart failure is. Heart failure, HF, also known as congestive heart failure, CHF, is a syndrome caused by an impairment in the heart's ability to fill with and pump blood. The term cardiovascular insufficiency is sometimes used when the heart functions poorly as a pump and does not circulate blood accurately via the circulatory system to meet the demands of the body. This generally leads to the syndrome of heart failure. This leads to high filling pressure in the left atrium and fluid accumulation and water retention. The water then retains too much fluid. The fluid accumulates in the lungs, which is known as pulmonary congestion. Now, we are going to talk about the signs and symptoms. We are going to discuss the most common signs and symptoms. People with heart failure might experience shortness of breath, persistent cough or wheezing, buildup of fluid, tiredness, fatigue, lack of appetite, nausea, confusion, increased heart rate, and weight changes. Shortness of breath may occur during activity or while at rest. Sometimes it comes on suddenly at night, making it hard to breathe. This happens because blood backs up in the pulmonary veins because the heart can't keep up with the supply. This causes fluid to leak into the lungs. A persistent cough or wheezing occurs when the fluid builds up in the lungs. Buildup of extra fluid, known as edema, happens in the feet, ankles, legs, fingers, stomach, and other tissues and organs. With heart failure, tiredness and fatigue feeling will occur. A person will feel tired all the time and have difficulty with everyday activities. They may also feel sleepy after eating, weak in their legs when walking, and short of breath while being active. Some people may experience lack of appetite or nausea. They have a feeling of being full or sick to their stomach. The digestive system receives less blood during digestive problems. People may experience memory loss and feelings of disorientation. Usually the caregiver notices these first. To make up for the loss in pumping capacity, the heart beats faster, causing increased heart rate. Sudden weight gain or loss can be a sign of heart failure. Reduced blood flow to your stomach can make it harder to absorb nutrients from the food and may cause weight loss. Extra fluid retention may cause your weight to increase. Let's talk about classes and stages of heart failure. There are 4 stages of heart failure: A, B, C, and D. Stage A is when people are at risk for heart failure but do not yet have symptoms or functional heart disease. The risk factors for people in this stage include high blood pressure, coronary artery disease, diabetes, and obesity. Stage B is known as pre-heart failure. This stage is people without current or previous symptoms of heart failure, but with structural heart disease and increased filling pressure in the heart. Stage C is symptomatic heart failure, people with current or previous symptoms of heart failure. Stage D is advanced heart failure, people with heart failure symptoms that disrupt their daily life function or lead to being hospitalized. There are 4 classes of heart failure. In Class 1, patients have no limitations or physical activities. Ordinary physical activity does not cause undue fatigue or shortness of breath. In Class 2, patients have slight limitations of physical activities. Ordinary physical activity results in fatigue, chest pain, and shortness of breath. In Class 3, patients are marked with limitations of physical activity. Less than ordinary activity causes fatigue, chest pains, shortness of breath. Class 1 through 3 patients are all comfortable while at rest. In Class 4, any physical activity causes further discomfort. In this class, patients experience symptoms at rest. Finally, let's talk about treatments for heart failure. Unfortunately, there is no cure for heart failure, but there are treatment plans. A treatment plan may include lifestyle changes, medications, devices, and surgical procedures, and ongoing care. Successful treatment depends on your willingness to get involved in managing the condition. Even though someone has heart failure, they can still lead full, enjoyable lives. Heart failure is not the same for everyone.